And welcome to our community. Susie Thomas here with you this morning, and we're visiting with Deanna Wells from Healthcare Freedom. Okay, Deanna, good morning.
Good morning.
All right, a little bit of a hot button. We're talking about healthcare this morning. Let's get into some history. You've been involved with this industry for some time. Tell us a little bit about you.
Well, I have actually been working in this industry since, I hate to say it, since I was 23 years old. And so I have been in this business for about 33 years.
Well, okay, first of all, you look awesome. All right.
Thank you.
You've been very healthy, evidently.
Yes, I've tried to be.
All right. Changes over the past few years in healthcare providers. It's really, for some people, was such a blessing, and for others, really ripped the rug out from under them. So let's talk about the people you've met. And how has this affected just, John Q. Public?
Well, I hate to say this, but it has been very negative in many, many ways. I have seen people that have had to drop their health insurance altogether. My day job, I'm Deanna Wells with Committed Care Insurance Services. So I am a health insurance agent that has helped small groups, employer groups, and also individuals secure an insurance policy. So what I've seen is many, many employers have stopped their employer group coverage because they can no longer afford it. So many people have lost coverage through their employers. And we've also seen people's hours shortened just so that they didn't have to work those people for 30 hours so that they did not have to cover them. So people have had to start two jobs because their first job cut their hours. And then the third, individual self-employed people, they have really recognized a huge impact in their income, or it's just the fact that their cost of healthcare, they can't afford it anymore, so they've had to drop their plans.
Well, help me understand this, because through my eyes, this is what I'm seeing. So tell me where I'm wrong here.
Okay.
It seems that there was a group of people who did not have insurance. They were not able to afford insurance. So in order to make them be able to have insurance and find affordable insurance, all this new legislation came to be, and we got the Affordable Care Act, and nicknamed Obamacare. The people who had insurance because they were employed and they got insurance through their employer are losing their insurance in order for the people not working for whatever reason, illness or whatever reason, aged, to have insurance. How am I seeing this right? It just seemed like it shifted from the insured becoming the uninsured and the uninsured becoming the insured.
Absolutely. What's happened here is there was always programs for many, many people. We had Ohio Health Risk Pool. That was for people who had severe pre-existing conditions that could not obtain health insurance. Mm-hmm. That was working. At that point, they were paying $400 to $500 a month for a $1,500 deductible, which was fantastic because now I have good, healthy people paying $500 to $600 a month for a $6,000 deductible.
Wait a minute, say that again.
I have good, healthy people paying $500 to $600 a month for one policy, paying a $6,000 deductible.
Oh, my goodness. Okay, that's unbelievable. How can anyone do that?
I don't know. I couldn't personally do it. That's a house payment. That's a wonderful, beautiful car payment.
And you don't get any help until you've already paid $6,000 out of pocket.
Right.
Okay, the other thing that I don't understand is it seemed to me that through free clinics and through physicians just caring for people who were ill, whether or not they were able to pay, people always had health care, right? They just didn't have health insurance.
Correct. Health care has always been available. Emergency rooms cannot turn you down. There was many free clinics. There is a program at the hospitals, even currently today, they call it the HCAP program, that is based on your income. So the tough part is the people that have lost insurance is the middle class America, and their incomes are just at that borderline where they're not going to get the help from those programs. But the people previously who did not have insurance qualified for those write-offs and also qualified for Medicaid. Many people qualified for Medicaid, they just did not go and apply. So the uninsured population was very skewed at the time that they were looking at this healthcare reform bill, which is AKA Obamacare. We did not have as many uninsured people as they portrayed. And now we have our middle-class America people are losing that health insurance protection.
They're the new uninsured.
Correct.
So the insured, though, are not paying for their insurance. Am I getting this right? The uninsured are still paying through raised taxes and so forth to cover this. Here's my question. Who's paying for this?
Oh, absolutely. The taxpayers are paying for it. The middle-class America is paying for it.
And they're the ones losing their insurance.
Correct.
Okay. You might want to just sit down where you are if you're listening. So we don't want to get everyone all hot and bothered about this. Just trying to figure it out. The other thing, before we get into a happy solution,
yes.
I want to ask you one more thing. It seems like more and more healthcare providers are pulling out, and they're saying, okay, this isn't working. So now what's happening?
Well, I just got a notice from Medical Mutual. They are pulling out of Stark County completely. So FYI, if you do have Medical Mutual, you in an individual plan, not an employer group plan, you will have to replace your program by January 1st. That means if you're on exchange or off exchange, they are no longer going to be offering people in Stark County a Medical Mutual individual program. So my phone has started to ring off the hook.
Oh, my goodness, because that's very good stuff. If it's offered through your employer, this does not affect you?
They will maintain the employer group, but they are losing billions of dollars, and they've pulled out of other counties in Ohio. This is just the main area I know of the radio listening area, is Stark County is going to be, very, it will affect us in Stark County.
So what happens as more and more pull out? What does that do to the public?
Well, obviously limits choices, limits choices in pricing. We are expecting at least a double-digit increase to the healthcare reform. It doesn't matter if you're on or off exchange. I have no idea what's going to happen with the subsidies. Last year, what we saw was the subsidies went down and the premiums went up. And most of my people had to go to yet another higher deductible, and that is also increasing to $7,150 for 2017.
Oh my goodness. Oh, my goodness. Aren't monopolies illegal?
Yes.
Okay, so if this is creating a monopoly, if we were able to break up Ma Bell, can't we break up whatever's happening here and go back to having more competition?
Well, I think if they change or repeal the healthcare reform, aka Obamacare, yes, there can be some different options. But right now, with offering maternity coverage to a 62-year-old male, this is what's driving rates.
I can guarantee does not need that.
That's correct.
Oh, my goodness. All right. Well, so there is good news on the horizon. In response to some of this, there has been some kind of a new network created called the Health Excellence Select. Yes, My Academy of Health Excellence. Let's talk about My Academy of Health Excellence. Okay. What is it, first of all, Deanna? And let me just say, we're talking with Deanna Wells. She's from Healthcare Freedom. There is good news, people, so pull up a chair and listen to what she's got to say.
Yes, there is an option out there that people can look at, because I got really, really frustrated not being able to help people, because that's the reason I do what I do, is I want to help people. So I started digging in, and I started looking at health sharing ministries. There are 6 of them. They had to be established by 1995, and I started looking at them in comparison to our traditional insurance world. Health sharing is not insurance. I have to make that very, very clear. It is not insurance, but it is a way to share healthcare cost in catastrophic events and even some routine things. and it works very effectively for some people. It's not for everybody, but it does work very effectively. So there are 6 health sharing ministries. In my search, I found that Liberty Health Share, which is actually local to us in Stark County, so we're really blessed, is one of the most user-friendly platforms out there for people. Along with that, I discovered my Academy of Health Excellence, and it is a platform of helping people receive health care, because this is all about health care, and having your bills shared. And the engine underneath that is the Liberty Share.
Okay. Let's talk, first of all, health sharing. Is this legal? Because we all were told if you did not have insurance by a certain date, you were going to receive a penalty. So is what we're doing, if we go this direction, legal?
Yes.
It satisfies all the requirements that the government is going to say we must have.
Well, health sharing is, first of all, it has to be a 501c non-for-profit. And it had to be established since 1995. It is about a group of like-minded people, either ethical or religious beliefs. And I do have the document from CMS, which is Centers for Medicare and Medicaid Services, that governs all of this. And Liberty Health Share and those other health share ministries out there meet the definition of that. And therefore, they are exempt from the Obamacare healthcare penalty. Health sharing has been around for a very long time. The Amish community has always done health sharing. So this is where this exemption comes from, is like-minded people banding together under the shared beliefs, and therefore it is exempt.
Okay. And I really want to get into just this whole concept of health sharing in our second half. But before we do, not to give you a pop quiz, but people might want to explore what all 6 are before they dive into one. Do you know them off the top of your head, or is there a place you could direct them to find what all the different health share ministries are?
Well, first of all, I think they can Google that.
Okay.
But I do know that there is MediShare. There is Samaritan's Purse. There is, of course, Liberty Share. MCS. Now, that health sharing ministry was after 1995, so they actually pay your penalty for you. So I don't really know how that works.
Okay.
There's one called Altrua. And boy, I can't think of the 6th one.
It's always hardest to come up with that last one. So, okay, Google, what would be the right thing to Google? Health ministries?
Sharing, health sharing ministries. Yes, that's how I would Google that.
Okay, and you have found, in your professional opinion, that Liberty is really doing the job for many, many people.
I think it's the most easiest transition.
Why do you say that?
Because they have a streamlined process. First of all, you are a group of self-pay patients, okay? But you receive a card, and Liberty has the electronic ID number on the back of the card. So when you go to your doctor's office, they have a system that they electronically send your bills into Liberty, where many of the other health sharing programs make you obtain the bill and turn that bill in. Also, they require you or request that you do your own price negotiation, because the whole thing about this is that as self-pay patients, we receive discounts. So it makes you, kind of takes you out of the piece of the negotiation, is Liberty does that for you. Okay. So a lot of people are not, feeling comfortable with that, but it also is that they are the fiduciary responsibility. So when you pay your share amounts, you're paying that to Liberty. Liberty holds the money and then processes, they pay the claims from each person's share box, and then they provide an explanation of sharing to you via your computer. So it is all online, but they are very much streamlined, where the other ones you have a little bit clunkier. Not saying anything against them. It's just that Liberty, I would feel, is the most user-friendly for people transitioning from that old insurance world to a new program with a whole new mindset. It really helps you. And then Health Excellence actually helps you even more, and we can touch base on that.
We certainly will. Talking with Deanna Wells from Healthcare Freedom. We're going to take a short break and be back after these words. You're listening to Our Community.